Please, let's start.
Yes, ma'am. So good evening, one and all. It is an honor to welcome you all back to our Advances in ART Masterclass, Advances in Embryology Masterclass. So as you all know, we have two masterclasses every month, one in embryology and one in advanced ART. So we have an esteemed pioneer speaker with us, Dr. Charudutt sir. Before Dr. Vasundara introduces Charu sir, I'd just like to make a few announcements. So, as you all know, the Immune Code conference, which is the Reproductive Immunology Conference, is happening on the 25th and 26th of July. So, we're happy to announce that the workshops are full, which is the LIT training workshop and the case based discussion workshops are full. But if you're still interested to register for the conference, you can do so. It's happening in Bangalore. And on that note, with the blessings from Dr. Vasundara and our seniors, we're very happy to announce that we're going to offer the courses Basic Embryology, Advanced Embryology, and Basic ART courses. So the details regarding that will be shared in our group shortly. And whoever's interested can get in touch with me so we can customize it and do it according to how you want it. And the next masterclass for this month is going to be on July 23rd by Dr. Shobhana Patel ma'am on female fertility preservation. Vasundara ma'am, can you please introduce Charu sir? Before you officially introduce her, I'd like to say he's one of my most favorite people because he is so humble and he is so approachable despite all his achievements in life, personally and professionally. So, sir, I'm truly one of your biggest fans and I'm happy that I can interact with you, sir. Ma'am, kindly introduce sir, ma'am.
Very good evening, one and all. It is indeed a great privilege and honor for me to introduce Dr. Charudutt Joshi, sir. Though he's going to talk about the heart of the lab, mastering IVF incubators, I'm sure he is the heart of many, many embryologists who have trained under him, and also he is extremely humbled for you to have accepted this teaching program and being a part of this masterclass series. Sir is a postgraduate in life sciences. He's an MSc, PhD, trained at Belgium, and he's served as an office bearer of various societies like ISAR, IFS, ACE, ISSRF, ISPAT, etc. He was a past vice president of ACE, past president of ACE, medical director of Genes India ART Bank Indore, lab director at Gandhi Medical College Ujjain, past chairperson of ISAR Embryology 2024-26, and he's a recipient of Lifetime Achievement Award. It's indeed a great honor to have you here, and we would like to hear from you the heart of the lab, mastering IVF incubators, which every embryologist would agree that definitely incubators are the heart of an IVF lab, apart from the embryologist working in the lab. Over to you, sir. The virtual platform is yours for the next 1 hour, and then we would love to interact with you and learn from you. Thank you so much.
Oh, thank you, Dr. Anuradha, for nice introduction, and thank you, Sindhuja, for such lovely words. It's almost now 36 years in this field, so I really feel happy that I have contributed up to whatever possible extent I could in the field of embryology. But still, lots of things needs to be addressed, and in future, so many new things are coming up. So it's very good that you have taken this initiative and you are gearing up the young generation of embryologists for the future. So with this, once again, thank you for inviting me. And the topic given was, as we all know, Madam rightly said, it's heart and soul of IVF lab. And it's if you have total control on your incubator, I think your 50% of the results are automatically taken care of. There's no need to see other things. But yes, if you properly focus it, you have to have the in-depth knowledge of incubator. And that's why from the beginning, my concept is always like that. For being an embryologist, what you need is the skills of performing, skills of knowing the machine. Like for example, ICSI, if Dr. Sindhuja sits on machine, set everything and tell anyone that you have to just move this needle like this and you can be inside, outside, it can be done. It can be done very easily. But the main crux is in setting up of the angles of that needle and making it perfectly horizontal to the surface so that you have a nice crushing of the tail. So saying all this, I would like to start my presentation. Should I share now my screen?
Yes, please, sir.
Okay. So, is it visible?
Yes, sir.
Okay. So, in this talk, what I am going to cover is what is the history of incubator, then what kind of incubator, evolution of incubators, and then finally what things are there to be taken care in an CO2 incubator and what is latest coming up in future on incubator. So this we will cover one by one. Okay. So why there is a need of CO2 incubators, we can very well understand this that mammalian embryos are exclusively sensitive to physiochemical perturbations. Even transient deviation in pH, temperature, or gas tension can impair developmental competence. Now, in very simple language, if you want to understand, we are trying to mimic the natural uterus in form of an incubator where we are trying to provide whatever actual conditions are there inside the body in vivo, that is, we are trying to give in vitro. So pH, temperature, gas, these all parameters in a controlled environment is given for the embryo development. And we also should consider this point that this is very initial stage of life, that is starting of life or the development of embryo. So it is more critical because once things are established, it is developed and then something can be taken care by its own. But initially we need to give them exactly atmosphere similar to the whatever there in vivo in the uterus. So it must replicate as closely as possible. Now we also understand that it's not possible to give 100% exactly replica of whatever there is inside. But what we can do is we can. Hello. Yeah, I'm audible.
Yes, sir. Yes, sir. You're audible.
Sorry, sir.
Yeah. Yeah. So what we need to understand, we cannot give exactly, but we have to be very close to whatever there is in the natural scenario. They are Incubators are the primary technology enabling stable culture conditions. Their performance directly correlates with embryo quality and clinical outcomes. That's why it is called as heart and soul of the lab, because your IVF outcomes is purely depend on what your incubator condition is and how the parameters are controlled. Key parameters which controlled are temperature, carbon dioxide incubation, carbon dioxide tension, oxygen tension, relative humidity. These are the key parameters which we control in an incubator. And there are a lot of studies which shows that suboptimal culture conditions is a significant contributor to unexplained IVF failure, poor quality embryo development, poor fertilization, poor results and all. So incubator quality control is very, very important part of this IVF industry. Now, the IVF laboratory is a highly engineered microenvironment. The CO2 incubator is not merely a warm box, it is a precision life support system for human embryos during the most vulnerable phase of development. Every parameter it controls has documented embryological consequences. Now, it's very easy to understand that what we are working as an embryologist is highly technical, skilled person working with this highly technical evolved machines and particularly CO2 incubator, which is the most important part of the lab. And anything if goes wrong in the incubator is going to ultimately affect the result. Now, just to have basic information or definition about CO2 incubator is a sealed microprocessor controlled culture chamber that maintains stable physiological conditions, temperature, carbon dioxide, oxygen, and humidity. In IVF, it serves as a primary environment for gamete preparation, fertilization assessment, and then embryo development from zygote to blastocyst. The control parameters are CO2, temperature, oxygen, we already discussed. Modern IVF incubators are now coming up with added facility like filters, filtering volatile organic compounds, hydrocarbons, and airborne pathogens via HEPA and activated carbon filtration system inbuilt. Classification by gas regulation, traditional large volume, shared versus benchtop mini incubators. These are all we will discuss in coming slides. The history of development of incubators, how they develop from a very big box type of incubator to small benchtop or mini incubators nowadays. A CO2 incubator has evolved from a simple heated box to a sophisticated multi-parameter controlled system. The embryologist must understand every component from sensor technology to gas regulation to maintain optimal performance and troubleshoot deviation. So now my main focus is like, and I always say that it is, you are no doubt that you are very good in your IVF skills and all, but as far as machineries are concerned, system is concerned, that is also part and parcel of our duty to understand its mechanism, so that if something is not correct, and then you, there is no need to wait for an expert engineer to come and all. Some things at your level, if you can do, you should be in position to do it. Now, just a little bit of history. 1978, we all know it's all started in 70s, and then slowly it started developing. Firstly, what we see was the large water jacketed incubators. Still, in some places, we are still using water jacketed incubators, which has its own advantages, disadvantages. Then in 1990s, 2000, air jacketed system came, which was considered superior than water jacketed system just because maintaining and cleaning and everything was easy with these systems. With IR sensors, thermal conductivity sensors. Then in 2000 emerged low oxygen tri-gas incubators, which is just another effort trying to mimic the natural environment, whatever there in vivo conditions inside the body. So that's why the low oxygen concentration on day 5 or till blastocyst culture. So these low oxygen tri-gas incubators are evolved. Then benchtop incubators, the same, they are the smaller one with the individual chamber, low contamination risk. The main point always in incubators, what we have to see is the recovery rate, because you open and close the system so many times. So how fast it regain its normal parameters, that is also very important parameter for while selecting a good incubator for your culture conditions. And we all know the small chamber, small requirement is there, and then that's why the regaining of the normal system is very fast in the benchtop and small incubators. Then in 2000 till present, we have time-lapse monitoring systems. Various types of systems are available in the market now. They are integrated with cameras, and now latest we have AI also integrated in for the selection of the best possible embryos out of the cohort. So this is how they are developing. Small future, what we are looking for is more advanced and more technologically evolved incubators, which have the better quality understanding of better quality selection of embryos. Now, just these are few pictures. I always show this picture in this talk. This desiccator, what you are seeing, this lady is Liz Brown, which is now the, we all know her. She is the first IVF documented IVF baby. I still remember in 93 when we started this, I started my career as a reproductive biologist. That time only two things were there. I was knowing reproduction is there and biology is there, but this IVF was totally new thing. And we used to do IVF at that time in such kind of desiccators, which is shown here. As you will this kind of big normal warming incubator which maintain 37 degrees centigrade, industrial incubators or what you say bacteriological incubators were there. We used to fill water in the pan or the bottom of this desiccator, and then this is sealed um, um, and kept inside incubator for 2 days to gain the temperature and all. And then there is the volume of this desiccator is calculated, and 5% of the this volume, CO2 is introduced from the top, and then our dish with the oocyte and swarms are kept inside. It is sealed with the sealant, and then like a wax or something, and then it is kept inside this big incubator for another 2 days without disturbing it. That's how this all IVF started, and you all know today where we are. And this is kind of suction machine which at that time we used to use for the home pickup. Pressure was reduced to minimum, and so many means in-house developments were made for making as low as possible. This is normal suction machine which is there in the operation theaters. So types of CO2 incubators, whatever available today is water jacketed, air jacketed, benchtop, time lapse, tri gas, and now we have a hybrid system which has time lapse technology with tri gas incorporated, and in very soon we are having AI also fully integrated in these incubators. So, just to summarize this point, no single incubator type is universally superior. Selection depends on patient, volume, budget, available space, and laboratory SOP. However, tri-gas capability and time-lapse integration are increasingly considered essential in high-performing IVF units. So now what happened? Initially, when this technology was introduced, it was very costly. And because of new technology, people were little bit reluctant because there was no solid evidences and so much of research activities were going on. But now it's a well-established fact that these machines are really helping in selecting, or better we said, deselecting the embryos. It shows us the developmental potential and the implantation potential of embryo. And now AI integration has further sophisticated this system. So, and the cost wise also, I think it is now in a very reasonable range that a good working center can afford very well these highly sophisticated instruments. Now, just to understand a little bit mechanism of action in these incubators. So, CO2 regulation, how the CO2 is entered inside is a via solenoid valve. You always heard a sound of injection of the whenever gas is injected in the chamber. This is a solenoid valve which is very sensitive, and that's why the pressure of ingoing gas has to be maintained at 1 bar. We'll discuss this. There are two gauges in the your pressure regulator. One is your CO2 cylinder, and one is your ingoing gas, which is going from cylinder to the incubator, which has to be maintained below 1 bar or 1 bar max to have this solenoid valve in perfect working condition. This is very sensitive valve. If high pressure is given or if very low pressure, this valve will not function properly and your CO2 regulation will not be there. Then second is temperature control. This is controlled by the heating elements in air jacketed, water jacketed, where water is heated and maintained at 37 degrees centigrade, which is monitored. Now, just we can very well understand that why water jacketed incubator were introduced that time and was considered superior, because once the water is heated and it is inside a jacket, and if suppose something goes wrong with the power and your incubator is even shut down for some time, it was supposed that because of this water it slowly cools down, so it will maintain temperature, and that's how this not affect your culture conditions inside the chamber. But when these air jacketed incubators have come, the recovery was fast, the maintenance was easy. In water jacketed incubator, chances of contamination, refilling of this water, cleaning of this water chamber, so many things were there. So that's how this all happened. Then humidity is maintained with the a pan which is there in the inside the incubator in the bottom, which is filled with demineralized water, sterile water, and because of heat, it keep on evaporating. It helps us in maintaining the drying of the media and osmolarity changes in the media by maintaining humidity by 95%. Now, there are gas sensors, which is basically two types, infrared sensors and thermal conductivity sensors. Both has it their own advantages and disadvantages. Then chamber purging, that is the inflow of carbon dioxide and oxygen after door opening, and once it is closed again, the time taken by gas to refill and to come to its set values. Then alarm system. Each incubator has fitted now with this monitoring and alarm system. If any parameter is disturbed and if any parameter is not working properly, it will give an alarm, which is an indication that you should see what is wrong with the incubator. So, understanding sensor technology is critical for QC. Infrared sensors can drift due to sensor aging and contamination. Annual recertification against primary traceable references is mandatory. Thermal conductivity sensors are humidity sensitive and require more frequent calibration. So, as I said, both type of sensors have their own advantages and disadvantages. But what more important here is nowadays is that you should have an regular maintenance of your incubator by an external agency, having in the form of an annual maintenance contract, which will certify this that your incubators are working good. They will check the concentration of CO2 and humidity and temperature, and they will certify. No single incubator type is universally superior. That we have already said. You have to decide about your incubator by deciding about the patient load and volume and budget and whatever facility you can offer. You cannot offer each and everything in your place. You cannot integrate whatever is available in the market. You have to see so many factors before implementing it, and that's why. And system should be in place in the form of SOP, what is you are doing in the lab and what is your requirement. This can be discussed with the lab director, with the clinician, and then you can just upgrade your system, your laboratory with the new machines, new incubators. So we all know we have buffering system, which is there. All our medias are buffered media. There are two types of basically bicarbonate buffered medium, which needs Heap's buffer system and bicarbonate buffer system. Bicarbonate buffering system needs CO2 incubator equilibration to maintain the pH. The normal pH range, what we want in our media is 7.2 to 7.4. And then again, you have to understand here that when this all started, initially we used to keep our CO2 percentage at 5%. Now it's 5.5, then now it's 6%. So now what happened, what changed is there is that this media composition is constituted in the way that in between 5 to 6%, if you keep CO2 percentage, your pH will come between 7.2 to 7.4. But actually, if you want to really know the CO2 concentration, you should always measure the pH. pH will give you the accurate measurement of your carbon dioxide concentration, and accordingly, you can set the values in your incubator. As I said, AMC and is the best part to have your incubator certified by an external agency. Blood gas analyzer is the best analysis instrument considered, but again, it is not very handy and very easy available in all IVF labs. So we have to depend on our pH measurement or CO2 percentage measurement only with our normal analyzers. So pH is arguably the single most critical variable in embryo culture. We all agree, yes. The bicarbonate system is elegant but requires precise CO2 control. Yes, because this is going to maintain our pH. Embryologists must verify actual media pH, not just incubator CO2 reading, as sensor drift, incorrect media batch, or improper gas supply can create a dangerous discrepancy. Now, this in simple line, if you want to understand, you have to have belief in your pH measurement, which can be done like what is limitation of pH? pH instrument needs to be calibrated regularly. Very high precision pH meters are little bit expensive, and then it's not like that daily you have to measure the pH. You can always see the CO2 percentage, but yes, once in 6 months or once in 3 months, whatever is your protocol, you need to verify your CO2 percentages with the help of the measurement of the media pH, which gives you the accurate result. Now, this is just an schematic diagram of an CO2 incubator. It's a box type incubator. It has display of CO2, O2, temperature, then on-off switch, alarm system. Then inside you see there is a fan which circulate the air, hot air inside. In the bottom there is a pan where water we fill. These are the shelves, and this is a single door incubator. After this, there is a multiple door incubator also can, considering that you open only one portion of the door, so the exposure is minimized and not all of your dishes are exposed at a time. And that's how this benchtop incubator with individual chambers concept has come. That you open one chamber, so rest of the your dishes are unexposed and they will maintain, and the culture is much better than the single door incubators. So human embryos are optimized for 37 degrees centigrade. Deviation by plus minus zero point 0.5 degree alters spindle formation, chromosome segregation, mitochondrial ATP production, and cell cycle kinetics. So you can understand what is the importance of maintaining CO2 incubator and calibrating CO2 incubator. Heating systems, again, if it is too much heated, if it is less heated, again it is going to create problem with the embryo development. Door opening, closing, heated stage and surfaces, documentation, daily temperature, log, quarterly calibration, verification. These all are the system you can incorporate. Keep on measurement, keep on doing quality control, quality analysis. It definitely helps us in improving the result. I always say whenever you go for a certification like NABH or your ISO certification and all, what these people get you forced to do is documentation and SOPs in place so that you should work smoothly. There should be no hassles at the time when there is any problem. Everyone should know in the form of SOP in this, what is the protocol to be followed in this situation, what needs to be done. So this is very important. So temperature is most universally critical parameter. Even embryologists who cannot control CO2 supply disruption can prevent temperature deviation by minimizing door openings, using pre-warmed media, and maintaining a disciplined working protocol around the incubator. Now, you can understand that's why there is now minimum requirement of 2 incubators. Anyway, we are always advocating 2 incubators are required in a normal IVF lab, because if something was wrong with one incubator, at least you have a backup incubator. And the second most important concept was that you use one incubator as your working incubator. Working incubator means you have suppose 2 pickups in a day, or 3 pickups in a day, or 5 pickups in a day. You one incubator which you will be using, that will be just for collecting the oocytes, keeping there, and then again taking it out, again keeping it there. Once pickup is done, you shift from this incubator to your culture incubator, which will be less opened frequently, and that's how you can just manage the system. Now, gas environment, again, after seeing temperature and pH and all, now gas atmosphere is also very important. CO2, it maintains pH by a bicarbonate buffer. Atmospheric oxygen is consumed by these incubators. Low oxygen cultures, what we are saying is that we are trying now blastocyst culture. Most of us are now doing blastocyst culture. Most of us are doing transfers at blastocyst stage. And this stage requires low oxygen atmosphere, which is suitable for blastocyst development and transfers. Nitrogen, it's a inert gas, which is just to balance the system. And gas purity, now again here the situation is ideally we should have medical grade CO2, medical grade gases, medical grade oxygen, but actually speaking, there is very limited supply of this medical grade gases for us. So what we can do is we can use external filters like inline filters or box type incubator inside filters, or room filters, or so many things are there which helps you in making your gas further purified. The shift from 20% to 5% oxygen culture is one of the most evidence-supported changes in IVF practice in last 10 years. We all know now blastocyst is the key. ISHRE guidelines also recommend low oxygen culture. Its best practice laboratories without dry gas capability should prioritize upgrading, especially for patients with recurrent implantation failure. So, why this is there? Because you have to understand that now in this competitive field, what you are doing is how many number of cases you are performing and what is your outcome and what is your pregnancy rate. That matters a lot, and you have to achieve that standards and that goals. You need to have a good culture system in place. So after temperature, pH, gases, humidity control, as I said, humidity is required to maintain just to prevent evaporation of media. Most of the incubators now, there are, again, on basis of this, there are two incubators, dry incubator and moist incubators. Dry incubators are like benchtop incubators, mink incubators, where there is no water supply. So normally in this, what happens that everything is covered under oil and the oil layer dishes are kept in these incubators in low oxygen atmosphere. So because of oil, there is no evaporation of the media and osmolarity and everything is maintained. But here we require high amount of uh, uh, oil to maintain this, and then again incubating that oil prior, and so many plus and minus points are there. In the moist type of incubator, there is an additional water bottle, and the gas first passes through this bottle in the form of a bubble and then goes to the chamber. So it's humid in nature. So it helps in maintaining up to some extent the humidity in the benchtop incubators. And in big incubators, box type incubator, we know anyway there is a pan which is filled with water. Whatever is the suggested quantity, we need to fill it and then we run the incubator. So it maintains the humidity, which ultimately helps in maintaining osmolarity of the media. So humidity management is often overlooked until contamination occurs. Embryologists should establish clear water pan maintenance SOPs, including the type of water used, change frequency, post-maintenance sterility checks, dry system, eliminate this risk but require different media handling protocols. Now, this is what we have just explained. This is very common question which is asked while maintaining the incubator, that how many days we should change the water. Are we supposed to change it every 15 days? Or are we supposed to change it in 3 months, once in 3 months or 6 months and all? So here, what we really have to understand is that the sterility of water to be maintained. And then it all depends on the workload, pressure, and system. So, like once you do overall maintenance of your incubator, so naturally you close it down, you clean it from inside, then you sterilize it, and then you auto start it, and then again it start working. So, in this case, recalibration is always required, because once you shut off the system and once again you on it, then it recalibrates itself. So measurement is required. But for changing water, there is no really need of shutting it down. You can change it while keeping it on also. And it is individualized. Like in my place, what I have seen is we used to change water once in a month, or maybe that is good enough. Unless until there is any problem is there with the pan water, there is no need of changing the water frequently. Now, these are the pictures of regulators. As I said, all regulator has two pressure gauges. One pressure gauge is showing the pressure of your CO2 cylinder or gas cylinder, and one gauge is showing pressure, which is pressure of the gas which is going in. So now, usually for CO2 cylinder, if we say, normally when you put up your this gases on the new cylinder is opening, it is normally 1500 psi pound square inch pressure. A full filled cylinder should show this much of pressure, and the other pressure gauge should show So means it has to be set around one bar pressure, which is good and suggested for the solenoid valve functioning. This white color system you are seeing is a filter. It's a normal membrane filter which is to prevent bacteria to enter in. So this can be fitted in between the pipeline between incubator and uh, your CO2 incubator and the cylinder. And this is who say for many brands are available. This is inline filters which has activated system in it, activated charcoal and other filters which removes VOCs also from the gas. As I said, getting medical grade CO2 or medical grade gases is a bit difficult in our country. So probably this is the possible remedy for getting purified gas out of your cylinders. Now, what is required protocols, best practice protocols, daily checks, that is for CO2, O2 display readings, alarm function, gas cylinder pressure, water pan level, document all value in validated QC logs. Now, documentation will come in later part also, but here what I want to say is whatever you are seeing, nowadays it is very essential and it is mandatory also that it has to be documented, and not only documented, it has to be countersigned by some witness or the other embryologist present in the lab, so that if tomorrow there is any discrepancy, we should be able to know when this is done, who has done, and how it is done. So the logging of your activities inside the lab will always help you. So you should do it. Weekly task, you wipe interior, outer. Nowadays, we are not using alcohol anymore for cleaning of incubators. It is the surface disinfectant which is available in the market that is used. You can monthly calibrate the system. You can quarterly also do the full mapping of your incubator. Annually, yes, AMC is a very good option. You always call an engineer from outside. In AMC, normally they offer 2 or 3 services, which is good. You can get it done. You can just verify your parameters, which is shown by the incubator. So this is a good habit to have an AMC for all instruments, not only for incubator, for all instruments of the IVF lab. So to summarize this point, incubator maintenance is not optional maintenance. It is a clinical procedure the embryologist is performing. It is responsible for the conditions in which a patient's embryos will spend the most critical days of their development. So SOPs must be written, validated, and followed without deviation. This is what we all want. We want that there should be uniformity. I do, he do, she do, whomsoever is maintaining that there should be an SOP in the place. And now again, you have to understand this SOP. What uh, normal guidelines says. SOP is not just a document you just write down stepwise procedure and keep it in your lab. It has to be validated again. It has to be countersigned by the facility director, lab director, and time to time there should be revision or review of these SOPs. If you are facing any problem, accordingly you can modify this. So SOP is not simply once you print it and fix it on the wall of incubator and then always you just keep on following it. So now the comes with the next part of this is maintenance. Maintenance, we are talking so much, then what are the options available with us for measurement? So we have gas analyzers which measure CO2, oxygen. We have pH meters. Handy pH meters are available now, which can with the micro pH probe, which can measure pH in the drop. So what we do is we make a drop, layer it with oil, keep it in the incubator overnight. Next day, with this micro probe, we just measure the pH of that drop of the media, and that's how you know. Now, again, here the important point is I have seen at many various places they have just purchased in CO2 analyzer like
0.25 മതിയായിരുന്നു.
hello. So
Sorry, sir. Sorry. Please unmute everybody. Sorry.
so just purchasing a gadget is not going to solve your problem or its worth, because they also needs to be calibrated. So there are standard agencies, there are government agencies. which get it calibrate for you, and then they tell you that okay, whatever actual percentage shown in your analyzer is deviating by 0.1% or 0.2%. So many time it happens we just focus on what readings are coming, and years together this CO2 analyzer is not calibrated. So that is not a good practice. You should get it calibrated at least once a year from a standard agency. Even this can be done by your gas supplier also. You can ask them, they can get it done for you. You send this instrument. Even our local vendors, our media suppliers, they all have this facility. They have a standard cylinder available with them with the standard measurement of gases. They calibrate the system against that cylinder, against that gas, and then with the calibration certificate, they send it back to you. Similarly, for temperature also, you need to have the calibration. Now, in this picture, we have this fire rate gas analyzer, which is previously, it's very common in older days. This was the only instrument available. So this was used very frequently for measurement of CO2, but now we have very advanced gadgets available for measurement. Now, what is the best clinical practice while using a CO2 incubator? Things are very clear by now. Minimize door openings, because we all know once you open the door and close, no matter you see the display has come up, but actually if you see inside, the regaining of the system takes time. So you should minimize opening, closing. Pre-warm always helps us, because if the normally what you can do is you can just keep your petri dishes or other disposables used in a normal warming incubator at 37 degrees centigrade. So whenever you take it out, it is pre-warmed. So during manipulation and keeping it back again, it will take lesser time to stabilize at 37 degrees centigrade by the petri dish or your whatever disposable. Embryo handling time, minimize this time embryo handling spent outside incubator. Again, this is going to help you in improving your success rate, improving your CO2 incubator performance. Gas supply, you should rely on your gas supplier. You time to time you keep on asking him. You can just get the gas also certified sometimes. Like usually they give, and with a supply of tri-gas incubator, they give a certificate of mixture of these gases, that this gas is 5%, this is this much, this is this much, which again you can just get it counter measured by your instruments, that whatever is written here in the certificate is correct or not. Usually it's done with the standard instrument, so it is correct. But I've seen many times there is a significant difference, minute difference, 0.1, and it's okay because it's an technical error or it's a machine error also. But if it is significant, then you have to consider. So this is also one of very important parameter, because you have the best incubator, but the gas supply is not good, then again you will end up in the same situation. Sterilization of incubators, water overfilling, again it will increase much higher humidity, which is again not good. It will help in increasing chances of contamination. So these all are the practices. Again, I will say here that you should have an SOP in place, and everyone should follow SOP. That is the best practice in today's scene. So incubator precautions directly translate to the embryo safety. This is very important. The IVF embryologist must treat every interaction with the incubator as a clinical intervention. Culture dish handling SOPs, staff training records, deviation reports should all be maintained as part of laboratory quality management system. So this is the crux of this entire talk, what we are talking about, that incubator's importance and its performance depend directly on the person handling it. And with that is, of course, embryologist. So now we'll come to the what are common problems we face with the CO2 incubators. pH fluctuations. This is the most common problem. How you understand this is by poor fertilization rate, arrested embryo development. This may be caused by malfunctioning of CO2 sensor, gas supply interruption or gas quality, improper media calibration, temperature instability, This is another important factor. These are all the parameters which is controlled by a CO2 incubator. So if there is a temperature fluctuation, excess heating or too low much or too low heating, it will again cause the impact on the embryo quality. There is destruction of the cytoplasm, skeleton, and DNA, or so many things can be impaired with the fluctuation in temperature. If contamination is there, this is a nightmare of an IVF lab. Contamination, once it is there, it is very difficult to get rid of it. So you should follow all aseptical conditions, and you should never have this contamination problem. Fungal contamination usually comes in the pan of water pan in the incubator. Otherwise, fungal infection in culture dishes are very rarely seen. But yes, it can come there also. Bacterial contamination is very often with the media. Alarm system, you should keep on checking alarm system, because there are many times it has happened that there is something goes wrong. There are now advanced gadgets available which gives you message on your mobile and alert on your mobile and all. But if that system is not working properly in incubators, you will not get the message. So again, time to time, cross checking and emergency checking will help us. There may be electricity failure, there may be humidity sensor failure. So all possibilities you have to um, understand and keep ready yourself for what we say is you should expect unexpected. Problems are inevitable, undetected problems are unacceptable. Every IVF laboratory must have a written contingency plan for each potential incubator failure mode, including patient notification protocols, data backup procedure, and regulatory reporting requirements. Now, here, what I started in the beginning, that incubator technology, at least the basics of that incubator machine should be known as an embryologist to us, that if something is wrong, we should be able to understand that what is going wrong, and is there any really there is any problem, and we should start acting on it, and we should resolve that problem. So that will come only once you know your machine in a better way. So this is again the what problems can be there in sensor drift, gas leakage is there, improper calibration is there, mechanical wear, some like very common thing I tell you. As this incubator goes old, the normal box type incubator, what we are talking about in old days, the dry air jacketed incubator, it has a gasket on the glass door. Now this gasket, along with the time, gets constricted and there is an little bit gap started forming, and there is no airtight closing of the chamber, which helps, which keep on releasing gas, CO2 gas slowly, and that's how the inner atmosphere of your system may be impaired. So you have to see these small things also. Human error is always there. We can always make mistakes, but that's why SOP is in importance, that if you have SOP, chances of error is very minimum, very less. So root cause analysis borrowed from aviation safety should be applied to every incubator deviation in an IVF lab, as there is no second chance. This is very important statement you have to understand. So many things are at stake. Identifying whether failure was equipment, process, or human related determines the correlative corrective action. Documenting finding is required by ISO 15189 certification and most national ART regulatory frameworks. So again and again, documentation is the most important part to analyze yourself. Now, troubleshooting of incubator, a systematic approach, detect, contain, transfer embryos to a validated backup incubator, diagnose what is going wrong, what is the problem, correct it, verified, and then backup system should always be there in the form of a service engineer or your biomedical engineer. If you are not able to diagnose it, correct it, you should take help of the service engineer. And that's why this is also very important. Being an embryologist, you should have very good rapport with the service industry. So on phone also, even they can guide you for the small minor defects which come across, and you can easily rectify it. but it all depends on person-to-person interaction. A written troubleshooting flowchart for each incubator model accessible in the laboratory reduces response time during a deviation event. Staff must be trained through simulation exercises, not just document review. The ISHRE Special Interest Group for Quality and Safety provides excellent templates for deviation management. This we can always refer ISHRE guidelines or ASRM guidelines, or for that sake, even we also have our own guidelines set by our own societies, ISAR, IFS and all, for safe and good practice, good clinical practice and good laboratory practices in our country. So this we have already discussed, impact of incubator conditions. If there is any change in incubator conditions, it deviates from normal condition, it is directly going to affect your embryo quality and its implantation potential. The embryologist is the direct custodian of the epigenome of future offspring. Suboptimal incubation is not merely a laboratory problem, it has potential multi-generational implications. This perspective should inform every decision about incubator selection, maintenance, investment, and quality culture spending. Now, this statement is very important to understand, because as an embryologist, we are the first person who is interacting, or we are handling the human gametes and embryos. So this is how it's a schematic diagrammation which shows how the pH is maintained. Then quality control, we are validation of CO2 incubator, internal quality control that is done by our own system with our own SOPs. Then, as I said, external quality control, that is also very important. It is done under AMC. The agency will come, they will calibrate it for you, they will give you a certification. Then biological validation, the culture conditions can be done with the help of mouse embryo culture assay. Performance indicators like blastulation rate, fertilization rate, clinical pregnancy rate, this all can be considered as an indicator for your performance of incubator, because any deviation from your normal, like many times it happens that we are getting good fertilization rate, good success rate, and all of a sudden in some particular time period it drops down. So this is a direct indication that there may be some problem with your culture conditions. You should see it very carefully. Documentation, again, it's very important. So quality control is not a paperwork exercise, it is a clinical governance tool. Trained analysis of incubator parameters alongside outcome data enables a laboratory to detect equipment-related performance decline before it translates into patient harm. This is the essence of quality-driven IVF program. So again, quality control, quality management, quality assurance, these all are the terms which is now very frequently used in our fraternity, our IVF field, and has to be given its due importance, and it has to be considered for all IVF center for good practice and good success outcome. So as I said, there are so many guidelines and SOPs available. You can always visit online and you can download it for your reference, and you can make your own guidelines also as per your lab, get it validated from some external agency, and keep everything always ready, all guidelines, SOP in place, so that anyone entering in the lab should first go through that document and then perform accordingly. That is the importance of that SOP. So regulatory compliance is not the ceiling of laboratory quality, it is the floor. Elite IVF programs exceed minimum regulatory requirements by implementing continuous quality improvement frameworks, publishing outcome data transparently, and investing in staff development. Safety culture starts with the embryologist at the incubator. Now, again, in simple language, if you want to understand, um, discussion amongst the colleagues. If anything is not happening correctly, discuss it, get it corrected. Mistakes are bound to happen, and unintentional mistakes is acceptable. But if you know the things and you are not discussing and you are not saying and you are not getting it rectified, then it's a problem. You should always have open discussion with the seniors and get it done. Now, what are the latest development? We have seen time-lapse systems is very commonly used nowadays. They are affordable now. Many systems are available in the market: Embryoscope, Petrolife, Gary Plus, Miri TL, Esco Miri. Then now AI-driven embryo selection is also added with these incubators, and this is giving excellent result. There are so many research papers are available now, and you can go through it and you can see the importance of AI. And everyone is talking about AI in future. It is already started incorporating in our laboratory system in the form of monitoring system, in incubator, in your laminar flow, in centrifuge, everywhere they have this AI system in quality control is selecting the embryo and so on. So AI is going to come and it's already started integrated. The integration of AI with time-lapse technology represents the most transformative development in IVF laboratory practice since the introduction of ICSI. However, embryologists must remain clinically vigilant. AI tools require prospective validation in diverse population before they can replace expert morphological assessment. Now, here again, this is very interesting thing. But many times this question is asked by many junior embryologists or the sometimes senior embryologists also, that are we going to replace with a robotics or with AI in future? No, I always say this is AI is what? AI is what we have generated. We have given algorithm. Accordingly, AI is working and selecting. So as an embryologist, our role is going to be there always. We are not being replaced by the any robot or any AI system. Although we now heard about robotic ICSI and you can sit at your home and you can do ICSI, but ultimately alignment of pipette is not done by AI. Na? That has to be done by an embryologist or a junior embryologist or a technician there. So it is we cannot be replaced with AI. So future of prospective, intelligent IVF incubators, smart incubator ecosystems, full laboratory integration where incubator parameters, patient identity, culture media, lot, embryo stage to link to a digital thread enabling real-time clinical decision support. So this is the integration of AI. You have more data to analyze. Then prediction, automation, robotics, as I just now said, it is going to come. Already there, we have robotic ICSI now. Organ on chip technology, we have culture dishes fitted with the chip on it, which helps us in analyzing so many things, data time to time, micro, this analysis of your proteomics, what we say is there now. We are seeing we are analyzing the culture, spent culture media for selecting by with the help of AI, consumption of ingredients and the production of byproducts and so on. Personalized culture conditions, regulatory evolution. As AI and automated mature regulatory frameworks will need to evolve to evaluate algorithm transparency, bias, and validation standards for clinical practice. Now, again, we have to understand this is not that easy that some company has come up with something and it is incorporated and everyone started using it. No, there is a system in place. They have to get it validated by various agencies before putting it in the market for the practical use. There are so many trials was done, multicentric trials was done, then the results is analyzed, and then once everything is normal, then only the technology comes in the market. So the future IVF laboratory will be data rich, AI assisted, highly automated, but the embryologist will remain essential as the clinical judgment layer. Technical literacy in AI, data science, and bioengineering will become core competencies for the next generation of reproductive scientists. So we have to like incorporating recent or latest techniques or latest instruments in the laboratory is important. Similarly, getting acquainted with latest technology, AI, bioengineering, this also is important part for an embryologist to learn. So key takeaways, CO2 incubators are the cornerstone of successful IVF culture. Precision in pH, temperature, gas control, not negotiable. pH 7.2 to 7.4 is maintained via bicarbonate buffering, set point 5 to 6%, which most of the incubators now have. Must be validated regularly. Low oxygen culture for good blastocyst developments. Temperature stability. Time-lapse incubators is a good option to minimize the disturbance while providing continuous morphokinetic data for AI-assisted embryo selection. Rigorous quality control protocols, documented SOPs, staff training, very essential. And then emerging technologies, smart sensors, VOC filtration, AI integration, transforming the incubator into an intelligent cultural platform. So these are the references taken. And thank you very much for patient hearing. I think I am within time, and whatever best possible I can share, I have tried to share. Thank you very much.
Thank you, sir. Like the topic today, you've truly made us master incubators and understand so much about it, actually. And like you rightly said, we need to know every single aspect of it. It's not just what the display is showing. So you have clearly explained all the parameters. Thank you, sir, for the time
No,
and
this is really a problem which I am seeing there, that the CO2 incubator, the inouts of the incubator is not known to many of us, many of our colleagues, many of our junior employees, this latest generation coming up. They should understand what are the sensors, and if something is going wrong, at least we should be able to differentiate it that yes, this is something wrong which is happening. So this is very important.
yes, sir. And also, another very important point that you said is having a good rapport with the service engineers to troubleshoot small issues over the
I,
phone
I,
itself.
I tell
Not
you my
sharing.
experience. I tell you my experience. This has happened with me various times. Like you are sitting on XC machine, you are performing, and your suction is not working. And online phone, they will just help me out of the way to solve that problem there and there itself, and I get through it.
Yes, sir.
So this is very important to have a good rapport with the people. They can understand you and they can help you out. Yes, if something is major breakdown is there, then okay, it cannot be done on phone, but small things can be managed.
Yes, sir.
Thank you so much, sir. Actually, one important point which you also mentioned was calibrating the QC equipments also.
Yeah.
This is this is what I have seen, madam. I have seen this at various places when they have this machine in place. There is a date written, last calibration done in 5 years back,
Yes.
and they are measuring with that. So there is no point. And there are government agencies. They very nominal cost they charge, and they get it calibrated for you. So you should get it done.
Sir, it will be very helpful if you can tell us which are the agencies, sir. I will.
Uh, National Analytical Agency, you have to find out. I will share with you the
Yes.
link if I have, but it is National Analytical Laboratory. It's Government of India enterprise.
Okay.
You have to contact them. You have to send your instrument to them, and they calibrate it. And with calibration certificate, they will send it back to you. And hardly it charges some 300, 400 rupees for calibrating your CO2 analyzer.
Okay, sir.
And that can be done with our vendors also, like this Shivani and Cooper Surgical and other people. They also have these sources and agencies which does it for them.
Once in 3 to 6 months, sir.
No, this calibration once a year is recommendation.
Once a year. Okay, sir.
Yes,
So there are some questions in the chat box. Can we take them, sir?
yes, yes.
Yes, sir. So my incubator shows CO2 display of 6, but calibration shows 5.4 or 5.6 at every calibration. Why does it happen every 2 to 3 months? Is there a problem with the incubator make?
No, it's not a problem of incubator make. I think you have to, as I said in my talk also, once you close it, shut it down, and again restart, it recalibrates itself. So at that time, with the calibrated instrument, calibration is very important. And if constantly your analyzer is showing 5.4 and the actual set point is 6, then yes, you have to show it to the service engineer and get it rectified, because if your system is not showing proper and your measurement instrument is calibrated, then I will give preference to my instrument, measuring instrument, because it is calibrated and it is standardized. So then we have to see for the incubator.
Okay.
And that's why I said that while maintaining incubator, just need to change water, no need to shut it down. You can just change the water and again you can just keep on working with it.
Okay. If blast relation drops suddenly, what are the pointers that would tell us it is due to the incubator?
It is the incubator only. Pointers means we have to see again the CO2 percentage, what you are getting. As I said, the tri-gas incubator, usually it comes with a calibration certificate. They show that this is the gas percentage, but many times it is actually not there. Your incubator is not maintaining the parameters. So if blastulation formation rate, I'm not talking about the pregnancy rate because that depends on many other factors or implantation rate. But if your formation of blastocyst, usually what I feel is should be around 60-70% blastulation rate is expected out of a good culture condition laboratory. So sometimes it is more also. It depends on embryo quality also. It depends on gamete quality also. But yes, culture condition mainly shows this. If the rate of blastocyst formation is low down, then you have to see your incubator parameters. So that's a direct incubator. Yes, if you see in very beginning on day zero that the oocyte quality is very bad, then definitely you are not expecting good quality blastocysts. But then if oocytes are good, then you should see your CO2 incubator parameters.
Okay. So next question is, in order to make sure culture conditions in benchtop incubators where calibration only shows the flow rate but not the percentage of gases, how do we validate it?
No, that's your, it depends on which analyzer you are using. Na? If you have this CO2 analyzer, so it shows percentage what is there, what is its measure. Or you see the pH directly, or you measure when you measure CO2, so it shows percentage on your monitor.
Yes, sir. And when they come to calibrate it and when they connect it, it shows the flow of gas and the CO2
No,
also.
the best part is I tell you, I have suggested this to many laboratories that see having individual instrument doing measurement daily is really not required. If it's really a working lab, then you cannot expect daily fluctuation or daily changes because the system is more or less set. So
Yes.
what best you can do is at least once in 3 months, you ask company person in under your AMC to come and measure it for you. That is better practice than measuring them yourself because many times we are measuring it wrong all the way.
Yes.
We don't know. Our machine is okay, but we are measuring it wrong. So then again there is an confusion. So
Okay.
best practice is once in 3 months, ask person to come and see and calibrate it for you. That is the best part.
Yes. So, someone has asked you discuss temperature. I would like to ask which factor is more critical, temperature inside culture dish or outside dish, or temperature difference gradient between the two? I think.
No, see, temperature is the most important. You see, 37 degrees centigrade is actually, we are expecting 37 degree inside the culture medium. In the culture medium, it should be at 37 degree. But yes, we can understand plus minus zero point 0.1 degree fluctuation is acceptable because it can happen. That's why we say that when you are manipulating them outside, that time also temperature is equally important because if inside incubator you are maintaining 37, but outside your heating plate is not at 37 or it is at 38 or it is at 36, it's going to create more problem because in incubator under oil, always remember that re-gassing and getting temperature is takes time. So as fast as you can do it and try to minimize this. That is the only possible way of reducing the fluctuations.
Yes, sir. Sir, and regarding power, there are two questions, sir. One is if the can we keep the incubator off when there are no ongoing cases, or is it better to be running all the time? Also, if there is a power failure, how long can the embryos withstand, and what should we do in such cases to prevent embryo loss?
Okay, so to answer first question, I have never recommend to shut it down if it is not in use. Once it is on, you should just keep it on because it hardly takes because you are not opening it, so consumption of CO2 is also very less. Because you have to see that once you close it down and once you again open it, again you have to recalibrate and again everything needs to be done.
Yes, sir.
So that is one part. And as far as this is concerned, that I said that because it is under oil and you are not opening. So many times it happens that the power failure is there and it takes some 5 minutes, 10 minutes to regain power and system is again working. So ideally, because you have not opened the incubator and they are under oil, so there should not be much fluctuation. Fluctuation will definitely come because, as we said, now we are not using water jacketed incubator. We are mostly using um, uh, this air jacketed incubator. So your AC is running and it is outside temperature is 25 degree and power goes up. So it is going to cool down your incubator also very fast. So you can shut down your ACs. You can just try to get the power on as early as possible. And the best part is to have a UPS online for incubator. We always have backup of 1 hour or 2 hours. Usually we have system like incubator on UPS and then UPS is also backed by the generator. So even if it is goes for 2 or 3 hours also your batteries or your UPS is not working, then you can start generator and then again start supplying the power. But in my experience, I've seen 5 minutes, 10 minutes, if it's shut down, it's ideally should not create much problem. But the best part is you should avoid it. It should not happen.
Yes, sir. Sir, I'm just combining a couple of questions, sir. How many times in a year should the incubators be serviced and calibrated? I think you have already mentioned that. And is there any relationship with the company of culture media and trigas composition? So, I think that.
I think this has been answered already. Again,
Yes,
that
sir.
because nowadays we are having one step media, which is single step media, which we are using nowadays, and everything is there, and most of the companies' medias are having same composition. So that's why instead of putting a fixed CO2 percentage, they recommend a range of percentage. So any time, anywhere between 5.5 to 6 is, or 5 to 6 is good. It depends on your where you are located. And best part is you measure the pH, and once it is measured, you know exactly what percentage CO2 you need.
Yes, sir. And sir, can you please recommend a reliable pH meter brand? Is a question.
I don't know. There are so many pH meters available, very handy. Online you order, no company, and so many companies are there. Internationally also it is available, and international companies are also available. Only thing is you have to see the probe coming along with that. What quality probe is it? You should go for the micro probe, and then you should see that whether there is a facility of calibrating this instrument is available or not.
Hmm.
You can go for any system. I don't remember any name particularly, but it is very easily available.
So another nice question, sir. They've asked, so when we pre-equilibrate media, we usually do it in a box incubator and then we culture it in benchtop. So is the 20% O2 and the 5% O2 difference, is it okay or not? They've asked, sir.
Again, it is a little bit tricky question. As you said, it's a good question. But see, ideally speaking, if you see the literature, it never recommend that in IVF cases you should keep your dishes in benchtop incubator. It's ideally meant for day 3 onward incubation and culture conditions. But because we are doing this, most of us are doing ICSI, and then after ICSI we don't disturb it and we just keep it for day 5 and all. So what I do in my practice is, yes, because you are incubated in 5% one and then now you are keeping in a different culture and condition. So what I do is I make the dishes a day before and I keep culture dishes in the benchtop incubator where I am supposed to put my post-ICSI oocytes for the culture. So that dish is incubated in benchtop incubator and the other dishes are in the normal incubator. So that's how you can minimize.
Yes, sir. Yes. So we can save space also in the benchtop.
Yes.
Sir, an ideal time for the media to be equilibrated. That's the last question, sir.
Ideal time if it's a new bottle you are opening. So most of the companies gives you media with the pre-equilibration. So even if 2 hours inside incubator getting normal temperature is sufficient. But if it's an open bottle, then overnight incubation is always recommended. Minimum 8 to 12 hours incubation is required,
So,
particularly for
so you're
culture
saying
media.
the media that we get now is pre-equilibrated, sir?
Yes, it is pre-equilibrated. Many times it happens, I tell you. See, if suppose you are in a situation that you have kept media overnight culture, and next time morning when you come 2 hours before and you see that there is something wrong with your pre-incubated media, then what you will do? You have to keep some media taken and your cases are planned. So in this emergency situation, if you have a fresh bottle, unopened bottle, you can take out media from that, just bring it to the 37-degree temperature in another 1 hour. That is sufficient because it is pre-equilibrated. Once you remove some amount of media out of it and there is an air gap inside, then there is a drift in pH. So that's why it's always see whenever you receive new media, you should see any leakage or any loose bottle or loose cap, you see immediate change in color of the pH. So that's how you can. This is an troubleshooting situation. Like if you have nothing, then this is the best option. And anyway, they recommend that once you open the bottle, you should consume it within a week. You should not use it more than week, and that's why small packings are available now.
Yes, sir. So one doubt I have, sir. So usually these cylinder changes, sir, we wait until it drops to at least 20. But sometimes when it is around 25 itself, we get scared and we changed. So what is the safest lower limit we can wait until we change cylinders?
See, ideally looking Indian scenario, particularly these cylinders, I have seen practically when these cylinders are, you open it in the where they refill it, you open it for some cleaning purpose and all. I have seen that there is mud, literally mud kind of material is there inside this because whenever you get a cylinder, it's not the new cylinder. They take your own old cylinder and give you the another cylinder, particularly for CO2. So ideally, in practice, what recommendation is that if your cylinder is 60% empty, you should change it. That is the best practice because then in that case, the impurities are settled down and you keep on using it that and then there is possibility that you will use, means in your incubator, the VOCs and other impurities will also go. So as far as CO2 incubator is, CO2 cylinder is concerned, 50-60% empty, you should change it. Try gas, you can go little bit more, 70-80% is consumed, and anyway we order at that time only so that on timely you get another refilled cylinder.
Yes, sir. Also, when the value starts lowering, suddenly it also gets very low.
Yes.
Okay, sir. Thank you, sir. You spent more than 1 hour with us, extensively answering all the questions, and I'm very happy all the audience
Really,
had so many questions to ask today.
it is nice to have so much interacting audience, and they are asking so much of questions.
Yes,
And
sir.
again, I just want to give this message for our young generation of embryologists. I always say everywhere, doing ICSI is not embryology. There is so many things other than ICSI, which is an essential part of embryology. And as an embryologist, we should be learning it and doing mastery in it. Masters in clinical embryology is not completed without mastering these techniques.
Yes, sir. I completely agree, sir, because I'll be telling ma'am also, ma'am, doing ICSI is the easiest thing. Everything else other than that only makes you feel like really like an embryologist, actually.
I think, thank you so much, sir. As a clinician, I learned a lot, and thank you for, teaching practical clinical pearls for us in our day-to-day practice, troubleshooting. I think as an embryologist, as she was mentioning, you were mentioning, ICSI is not the end all. Everybody thinks that I've done ICSI and then, that's all it is. I think
Well,
troubleshooting and, working with.
this is why I am saying is because whenever I talk with any newcomer and they say, हाँ ICSI आता है सर हमको. ICSI आता है, that doesn't mean that they are embryologists. Anyway, so it's nice to be here and it's always good. Sindhuja is a great orator. I've heard her so many times. She is doing nice work.
Thank you, sir.
So,
Absolutely, sir. And it's a very great privilege and honor for me to, work with her. And it's like we are together and we really feel blessed that, we are together and doing good work. So thank you so much for blessing us and always being a part of teaching. And thanks for accepting this for us, sir.
thank you, madam.
Thank you, sir. Take care, sir.
Thank you.
Okay, bye. So should I leave now?
Yes,
Yes.
sir.
Thank you,
Okay,
everyone.
ma'am.
We will see you again in the
Okay.
next masterclass. Thank you so much.
Thank you, ma'am. Good
Thank
night.
you.